I'm an orthopedic surgeon. I really specialize in evaluating knee and hip pain and arthritis. And so I focus on what we call adult reconstructive surgery, so hip replacement and knee replacement. But I've always held the philosophy that the replacement of a joint with metal and polyethylene is really not the first resort, it's the last resort. And so there are a number of products which support bone and joint health, and I use them in my practice. If anybody, as you mentioned, I have a degree in public health, if anybody even casually looks at the statistics, we're a nation of people who have vitamin D challenges. Not enough people have adequate levels of vitamin D. And so we have a vitamin D3 product with a vitamin called K2. Again, some of your listeners may not be familiar with vitamin K2. It's very different from K1, which has implications for clotting. But vitamin K2 actually drives calcium, normalizes the functions of calcium in the body so that it is taken up by the bone and is used in the bone and not deposited in the soft tissue. So I think it's very important to have a supplement that if you're going to put somebody on vitamin D3 as a practitioner, I think you really have to have the K2 alongside of it. So I think that's a very important product. I use a lot of something called a prime joint formula, which has a number of things that support and normalize joint health. And my patients really, again, they feel better while they're on it. I use something called glucositrin, and I think most people are familiar with glucosamine, but glucositrin has a number of herbal supplements in it which help to normalize inflammation. And again, people who take them, they see the results and they feel the results. So it works for my patient population. For acute inflammatory challenges, I use a product called bromelain, and I think that really helps people kind of with sprains and strains. They feel better when taking that. Again, it normalizes the body's ability to have an appropriate level of inflammation to support healing, but not to have too much inflammation that can lead to other problems. And as an orthopedic surgeon, any practitioner out there knows the problems that we're facing with nonsteroidal anti-inflammatory agents. We always knew that nonsteroidals pose a challenge to the gastrointestinal tract. We knew that they pose a challenge for people with kidney issues, but increasingly we're starting to understand that there are cardiac implications for using those medications. Not only that, but in orthopedics, we're really starting to understand that nonsteroidals may inhibit the healing of soft tissue injuries, sprains, strains, those sorts of things. And so it may be more prudent to stay away from some of the negative side effects. And the beauty of natural agents and nutraceutical products is that a lot of them can help to support the body systems to normalize health and avoid some of those side effects. And then finally, of course, everybody knows about calcium. Calcium's a wonderful product when used appropriately, and so I use calcium in my practice as well.